Hello, welcome to our channel Pregnancy Solutions with Gerald Massa. Today we are answering a question that is really so common nowadays, and the question is, how can a woman know that she is carrying twins? How can you know that you are carrying twins? How can you tell that you are pregnant with twins? And without further ado, we shall go to the first method of discovering that you are carrying twins, and this is ultrasound scan. You are requested that you do an ultrasound scan to discover what is happening inside your womb. The ultrasound scan will show images regarding the babies. It will show how the babies are lying. It will show the amount of fluid which is covering the babies, the amniotic fluid. It is actually called the amniotic fluid index. The sonographer or the doctor will tell you whether the fluid is adequate or it's not adequate. An ultrasound scan will also be able to tell you the gestation age and your expected date of delivery. All in all, the first step of discovering whether you're carrying twins is by doing an ultrasound scan. Thanks a lot, my friend, and we shall move to our next method, our next way of knowing that you are carrying twins. And this is what we call the Doppler heartbeat count. Your doctor or midwife will listen to your tummy. They will listen for the baby's heartbeats, and they will be able to get sounds of the baby's beats all over your stomach. And though it's not a confirmation of really what's happening, but at least it can give a clue that you could be carrying twins. Thanks a lot, and we shall go on to our next method of identifying that you could be having a multiple pregnancy or you could be carrying twins. And this is what we call, in most cases, they will discover that you're having what we call high levels of HCG. Now, HCG is a hormone. It is called human choriogonadotropin hormone. That is human choriogonadotropin hormone. This is a hormone released when a woman gets pregnant. The levels of HCG can be identified by doing a blood test for the same hormone. Although most times urine tests can be done, and of course still it can show whether there's positive or there's negative on the pregnancy test strip, but it does not give the levels of the HCG. So the best test we recommend is you do a blood test for HCG levels. If the levels are elevated, if the levels are very high, then there are chances that you could be carrying a twin pregnancy. Thanks a lot, and we shall go to our next point, and this is, there will be abnormal AFP levels. What are AFP levels? AFP is an abbreviation for alpha fetal protein levels. Now, you may be wondering, what is alpha fetal protein? Alpha fetal protein is a specific type of protein that is released when a woman is pregnant with twins. Although AFP tests can be done, they are most commonly done to determine or to detect birth defects, but in twin pregnancies, this protein can be released in high levels. The baby's liver is the main organ that releases the alpha fetal protein levels. So, if at all you are suspecting that you could be pregnant with twins, we recommend that you do the alpha fetal protein test, and if at all the levels are high, then there are high chances that you could be pregnant with twins. But mind you, the test for AFP levels can also show birth defects. So we always recommend that you discuss this with your doctor or midwife so that a conclusive plan can be made together with your gynecologist or your doctor. So thanks a lot. I hope you're learning something, and let me know if you have any questions. Like and subscribe to our channel so that you will be the first to get all the videos we put out, and you will be able to get all the pregnancy tips. So to be updated and to stay in touch with us, make sure that you like and subscribe to our channel, and we shall do our best. I will do my best to see that I bring out the best videos. The next step of identifying whether you could be carrying twins is this. The doctor or the midwife will do what we call the fundal height measurement, and in most cases you realize that the fundal height will be very large for the gestational age. What do we mean by fundal height? The fundal height is the distance is the distance from the top of the pelvis or the pelvic bone to the top of the uterus. In most pregnancies where there is a single baby, this distance is actually equivalent. It is actually in line with the gestational age. But when this distance has been measured and it is very large, there's a very big difference with the gestational age, then there are high chances that you could be carrying a twin pregnancy. Your doctor or your midwife will measure this distance, the fundal height, will do the fundal height measurement in the antenatal clinic when you go there, and they will be able to tell you really what is happening, whether the distance is normal or it's not normal. Thanks a lot, my friend, and we shall move to our next point, and this is weight gain in the mother, being an indicator of a possible twin pregnancy. Although weight gain in a mother could be due to poor eating habits, but it could also be an indicator that you could be carrying twins. You ask yourself why you could be putting on too much weight. Well, we know it could be due to poor eating habits, yes, but in most cases when a woman puts on excessive weight, there could be chances that she could be pregnant with twins. We move to our next point, and this is there will be excessive morning sickness. You will realize that most of the women who are pregnant tend to have morning sickness. We talked about this in one of our videos. You could go through in the videos below, and you will get that video where we talk about morning sickness and the causes. Just a brief summary. You realize that morning sickness is always brought about by accumulation of gastric acids in the stomach due to excessive hunger, and then also there's the vomiting center in the brain, which is always stimulated by too much stress, and it's also stimulated by not eating foods on time or eating the right foods. A woman eating oily foods. We know that morning sickness is common, but it could also be an indicator of a twin pregnancy if it is excessive. Always consult your doctor or midwife to make sure that the excessive morning sickness is ruled out or the cause is identified. Thanks a lot, my friend, and we shall go to our next point. Wow, it's actually a like and subscribe. Thanks a lot. And without further ado, our next point is frequent fetal movements will be felt. When a woman is pregnant and the fetal movements, your baby is moving very early on, maybe at let's say 16 weeks, 20 weeks, or even 20 weeks and above, the movements are very excessive. You're feeling the kicks from all over the sides of the abdomen. This could be an indication, because remember, if at all there are two babies, then we are looking at 4 hands, we are looking at 4 legs, and when all these are kicking, then there could be a sign that something is happening. It could be a sign that there could be a twin pregnancy. So when you are getting multiple and frequent fetal movements, the baby is kicking from all over the abdomen, then please don't wait. Do what we talked about in the first point, and that is go have an ultrasound scan, specifically an obstetric ultrasound scan. The scan will tell you exactly what's happening. Thanks a lot, my friend, and we shall move on. And our next point is this: there will be extreme fatigue and weakness. Because the body's demands for energy have been increased by the babies you're carrying, the twins, then there are high chances that if your intake of food, what you're putting inside, if it's not enough, then there are high chances that you could be carrying twins. So when you are having extreme fatigue and weakness, then don't sit back. Go talk to your clinician, go talk to your midwife, and let them check you very well. You could be carrying twins. Earlier on, when you discover that you're carrying twins, then proper planning can be made. Thanks a lot, and let's move on to our next point, and this is, if at all there's history of twins in the family, then there could be an intuition. You will be getting that feeling that you could be carrying twins, because actually twins tend to run in families. So if at all you have a history of twins, let's say on the paternal side, or on the side of your husband, or you yourself, the pregnant woman, if you have a history of twins, then there are high chances that you're going to conceive twins. Because most of the women I work on who are pregnant, we do ultrasound scans on them. When you try to ask, they will tell you that they have a history of twins. So a history of twins in the family is another sign that you could be actually having twins. If at all we combine all the previous symptoms we've talked about, all the previous signs we've talked about, and you are having at least 2 or 3 of them, and you have a history of twins in the family, then there are high chances that you could be pregnant with twins. Thanks a lot, my friend, for staying with me up to this point. Pregnancy Solutions with Gerald Massa is the channel you've been watching, and give a like to this video, subscribe to our channel so that you'll be the first to get any updates we put out, all the new videos we put out, anything regarding pregnancy, you will get it here. Pregnancy Solutions with Gerald Massa, the best pregnancy YouTube channel. We talk to you, we answer your questions. Have yourself a fantastic day. Like, subscribe, and remember to hit the bell so that you'll be the first to get our videos. Thank you, and bye-bye.